So, Dr. Michaelis, at what age do you generally see patients coming in to have their wisdom teeth removed?
Usually school-age children, so anywhere from 13 to 24 really is the age range we're seeing. The research is crystal clear and says if you're going to have your wisdom teeth out, it should be before the age of 25.
Oh.
So anytime up until that age, younger is better, but up until the age of 25 before we see the risks of surgery start to go up.
Well, I'm surprised at the large gap. I thought it was a lot narrower than that.
I would say the bulk of patients come in before they're 18. When I started practice 15 years ago, it seemed to be the 18 to 24-year-old age group that we saw most commonly. Now it seems to have shifted and it's the 13 to 18-year-olds. And it really doesn't have to do so much with age of the patient as development of the tooth. So there are some 12-year-olds that have fully developed wisdom teeth, and there's some 30-year-olds that have barely developed wisdom teeth. So it just depends on the
and
developmental
those possibly
stage.
would never need to be taken out then?
Possibly. It's very rare. If the exceptions to having your wisdom teeth out are the people who have enough room for them. If the teeth come through and properly position themselves, if they're accessible for cleaning and hygiene, then they theoretically can stay there forever.
So what's the original purpose for our wisdom teeth?
To give me a job. I think, honestly, if you look back at skulls, you know, Museum of Natural Histories throughout the country, if you look at the size of the jawbone on our ancestors from thousands of years ago, the jawbones were a lot more prominent. And that has a lot to do with diet. They were eating vegetables directly out of the ground. They didn't have In-N-Out Burger to process their food for them. So required a lot more muscle mass to chew our food back then. And as we're developing, muscle mass will dictate bone growth or bone size. So as we're chewing harder foods, the bones are growing a little bit bigger, allowing room for the wisdom teeth to come in. So there was a purpose for those wisdom teeth centuries ago, generations ago. But as our diet changes and our muscle mass changes and our jaw side changes, there's less room. So now they just get stuck. Same number of teeth, just smaller jaws to accommodate them.
Very interesting.